That's fine. That's fine. I don't care. I just thought somebody would be. Now everybody is. Okay, now that you all have your cameras out, this is the apex of the shoulder right there compared to this one right here. Right? So the corner, you guys can feel it on your own selves, like the corner of your shoulder in the front there. It's on the anterior aspect, basically your AC joint. Right? On him is right here. His AC joint on this side is right here.
Oh.
Right?
That one rounded.
Yes.
Rounded
So I'm going to take this one. I'm going to bring it in. One nice breath in. And be very quiet. Don't move.
Ooh. Nice.
Is it like high velocity thrust?
No.
No, not high.
Not at all.
Yeah.
Where was my thrust?
This is within our scope, right?
Mm-hmm.
Yeah. Nice.
Exactly. So the last bit of this correction that I do, I'm going to bring your headpiece down just a little bit, okay? Good. Try that. There we go. Okay, this table is a little bit high for me, but normally in order to get the last bit of separation, once I balance out from left to right, the last thing I do is try and increase space in the actual T-spine itself. Nice breath in. This one's going to take some practice for you guys. Don't resit it. Nice breath in. Again, I'm oscillating, so I'm allowed to.
Okay.
Drop it, drop it, drop it. Drop it. This table's really high. So you'll notice that for most of the T-spine, I'm coming in a thisward direction, right? For the top part here, though, soften your under arms. So normally when the table doesn't move, I can get a bit of a crick. There was a crick there, but the sound of the table overpowered it. All right, so that is a little bit of a general reset that I always do before I go in to actually palpate the individual segments. And now it actually feels like this side is opened more. Okay, so what I would like you to work on with your partner right now, very briefly, we're gonna spend a quick 10 minutes, possibly 15. I'll give you both 7.5 minutes. I would like you to try a little reset. Once you've reset, I would like for you to try and feel the SPs. And when you feel for the SPs, I would like for you to see if you can feel in the laminar groove of each. Okay? You know how I've actually already gotten you guys to start looking at rotations of the column in the CT junction and whatnot? Have I done that with you guys? I've done that with you guys, right?
No.
That's okay. See, I'm blending the spinal classes. This is why I can only teach one per term. So basically, all you need to do in order to see if there's a deviation, first, start with in line like this. See if you can feel what's happening down into the tissues. The more muscular their back is, the more you need to make sure that they're actually relaxing. And if they do have a lot of muscular tissue, it's going to be hard for you to be able to feel the TVPs. Okay, so right now I would like for you to try and landmark on the upper ones. Will be a little bit difficult because the scapula is right there, but see if you can find the SP and find the matching rib with it. Okay, find the rib, or it might be easier for you to actually start with a rib and then trace it back to its landmark at the vertebrae and see where that vertebrae's SP is in relation to where that rib is. Okay, so right now you're just seeing what you feel in your patient. So start with patient on the table, no shoulder supports. See, like spend a couple seconds to see how tissues feel. Reset their shoulders and then go back and see how much easier it is for you to palpate. Okay?
Where's the forearm placement when you went down the T-spine?
We're gonna get into that.
Okay.
Well, we're gonna focus on that primarily during the hyperkyphosis chapter.
Sorry.
No, that I knew that was gonna be a question coming up. People always ask for clarity on that one. But we'll give you more detail for the hyperkyphosis chapter. So right now it's just kind of like introducing you to it. You're kind of just getting acquainted with the idea. So go ahead and partner up with someone. No pillow palpation first. Put pillows, try a reset, repalpate, and then trade with your partner because we still have a lot of range of motion assessment to do and everything else. So nice and slowly, you want to get you to move yourself.